Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to go over Adele. Hello? No. I think there's been a lot of changes in Adele throughout her career. She's still pretty young, but we've seen some weight fluctuations, children, changing in her styling. I think all those things have affected her look throughout the years, and I think the recent changes are very positive. I think she looks pretty. I think they've been movement in the right direction. So I do think there's one thing to me, even though there isn't too much press on it, that looks to me fairly obvious, is there's a change in her nose. And that's a very common surgery, rhinoplasty, in anybody that's in the limelight media. Lots of stars that are on stage all the time. And that little tweak on the nose can make a huge difference. If you look at Adele when she's younger, her nose is quite a bit more bulbous, wider, thicker, and then now when we see her, her nose has become much slimmer, much more contoured, much more defined. And those are pretty much giveaway signs of rhinoplasty. As I always say, the nose isn't going to shrink on its own. Usually if it's shrinking, there's usually something else done to do that, and that's usually a rhinoplasty. So I'm very suspicious that she's had a rhinoplasty at some point here. And then I think we're looking at her, she's had some weight fluctuations throughout her career. And like I always say, when you see changes in the body and weight fluctuations, it always translates to the face. When we're looking at her now versus when she was quite a bit younger, a little bit heavier, and again, even though she's had children, or is it one child or two?
One child.
Just one, right? And even though she's had children or one child, she's really maintained that weight loss, and you can really see that in her face. So her face is much more contoured, less heaviness in the neck. Everything seems, just like I said, a little bit thinner, slimmer, and those translations have also translated to make her look prettier. Now, in addition to that, I do think what comes along with the limelight is better makeup artists, better clothing, better styling, better everything. So I think all those changes are very positive in her case, and I think people are noticing that and picking up on it, and they're going to say, is that surgical or not? And I think it's a little combination of both. I don't think she's had major surgery on her face other than the nose, and one of those reasons I think that she's lucky in her case is that she's young. She's in her early 30s now, and when people are younger and they lose that weight, the skin still has great elasticity. It's able to shrink down, shrink wrap, and come in. When you're a little bit older and you lose that weight, it doesn't quite shrink as well. You may have to look at surgery to lift things and tighten things, but in her case, just simply losing the weight, I think, has really contoured her face. Probably doing some other things, great skincare, maybe touches of Botox, maybe a little filler in the lips, maybe a little filler touch-ups in the face, just a little bit of maintenance because she's so young. So I think that really is working for her, and I think if she just continues along this path into her 40s and 50s, I think she's going to continue to age very gracefully, and I think she's doing all the right things.
I know you've touched on this previously, I believe in our top 3 celeb nose jobs or whatever, but Adele is obviously a powerhouse vocalist. Everyone knows her for her voice. I think I
thought it was for her dancing.
This isn't the Britney Spears video. There's definitely a sentiment that if you are a vocalist and you undergo a rhinoplasty, that your vocal cords will be changed. Is that true? And could we expect to hear a different side of Adele in her new album?
Yeah, it's an interesting question, particularly for her, because she did have vocal cord surgery, right? Now, having vocal cord surgery could definitely change your voice, The only thing that may change slightly when you're doing the rhinoplasty, right, we're staying away from the vocal cords. They're down here, nose is up here, right? So as far as the tone, quality of the voice, things like that, from the vocal cords themselves, it shouldn't affect the voice at all. And there's a lot of singers that have rhinoplasties, right? There might be a slight change as if they had more of a nasally voice or a little bit, more of that sound to it, and you were to improve that breathing or the nasality of the voice, you may see some of that decrease slightly. But as far as the tone of the voice, quality of the voice, and also if some of the people that have legitimate reasons, in other words, they do have slight breathing problems with their nose, and they're able to actually sing more powerful and get deeper breaths because they're able to breathe better if they do the breathing surgery along with the rhinoplasty.
Okay, last question, and you kind of addressed this, but with the weight loss, it definitely seems noticeable in her submental area. It doesn't appear like she's had a facelift, right? But you think her skin just naturally bounced back, or do you think she maybe did some of the non-invasive treatments like Morpheus or radiofrequency?
Yeah, when I was looking at her, it was interesting because if you look at her before and afters, you would be like, wow, she had submental liposuction or liposuction of a double chin or, under the neck area. But then when you hear the rest of the story, I lost weight and everything else, I think that's what it's really due to her losing the weight. And yes, in addition, because she's younger, I do think that the skin naturally was able to retract up. Now, If you were to mimic that and she hadn't lost the weight, that's how you would do it. You do the submental lipo, contouring the face, maybe some buckles, or you just lose the weight and you're getting a similar effect. Now, if she was a little older or was even more dramatic weight loss and there was some loose skin and it didn't snap right back, that's exactly what you do. You do a little bit of radiofrequency skin tightening, either that in combination with radiofrequency and microneedling skin tightening, all those sort of things to try and snap that skin back up and tighten it up. I think she's young enough that she wouldn't need a facelift to do that right now. But there are patients younger than her, or even so, that lost significant, hundreds of pounds of weight, and they do have the loose skin. Then they would be doing, a facelift in a younger patient to tighten that up and lift everything.